Welcome back. We're going to go back to the new coronavirus now, what to make of its spread and how it could disrupt your life. Joining me from Toronto General Hospital is Dr. Isaac Bogoch. He's an epidemiologist and a specialist in infectious disease. Dr. Bogoch, first let's deal with travel. Lots of people have trips booked to Asia and Europe and Iran. It's hard to know whether to go or to cancel. What would you tell your family?
I think it's extremely important for people to remain up to date on what the current travel advisories are and what the current travel warnings are. Certainly, we know Canada has very publicly made this very widely available on their websites, certainly with the travel advisories. But I think it's important that people look at their destination countries as well and any points of contact along the way toward their destination. The other challenging feature here is that these might change with time, so it's important that people stay up to date on what these travel advisories are.
So, washing your hands, coughing into your elbow is great advice, of course, but the way this seems to be spreading, is there really a fail-safe way to protect yourself?
No, I mean, there's just things that we can do to reduce our chances of getting this infection. And I know during influenza season we have these recommendations and these recommendations still stand for the COVID-19 infection. We also just have to remember that COVID-19 is a respiratory infection as well. So, you know, impeccable hand hygiene is crucial. Coughing and sneezing into your arm rather than into the air around you or into your hands is also important. And of course, if people are sick, stay home so you don't infect anyone else at work or at school.
Yeah, staying home, probably the best advice. We know that most people who get this virus do survive, and it's important to keep saying that. But we've been told to prepare for this to disrupt our lives. What do you think that means in practical terms for most people?
Well, it's not yet clear what the impact of this will be in Canada. Certainly, we know that there's going to be more cases, either imported cases from other parts of the world, and even the potential for locally acquired cases as well. Of course, as you point out, most people that get this infection are probably going to do just fine and have a mild course of infection. But yeah, some people are going to get pretty sick. So I think it's just important to be aware that over the next few weeks to months, we're likely to see more and more cases of this, and to be prepared. I mean, if people have chronic medical conditions, now is the time to go to your primary care provider or specialist and ensure that you're up to date on all your prescriptions, up to date on your vaccinations, up to date on ensuring that your health is optimized before we start to see more of these cases here in Canada.
Quick final question. Based on what you know so far, do you think this virus can be contained?
No, I don't think it can be contained. Certainly the massive public health initiatives in China slowed the spread of this virus down, and it really bought the world a few weeks to maybe a few months to prepare for this. Hopefully governments and healthcare systems really used that time wisely and scaled up capacity at the laboratory level and at the clinical level to prepare for the inevitable imported cases that they're going to be seeing over the next few weeks to months to come.
All right, Dr. Isaac Bogoch in Toronto, thanks.